Welcome to the Professional Development course, Bloodborne Pathogens, brought to you by Kayamishi Tech's Workforce and Economic Development. In this video, we will cover: what is a bloodborne pathogen? Hepatitis B, Hepatitis C, HIV. Recognizing and eliminating bloodborne pathogen exposures. Sanitizing hands. PPE. Clean up. What are bloodborne pathogens? Disease-causing viruses, bacteria and other microorganisms carried in the bloodstream. The most common bloodborne pathogens are human immunodeficiency virus, HIV, hepatitis B virus, HBV, hepatitis C virus, HCV. What is hepatitis B? Hepatitis B is a vaccine-preventable liver infection caused by the hepatitis B virus, HBV. Hepatitis B is spread when blood, semen, or other body fluids from a person infected with the virus enters the body of someone who is not infected. This can happen through sexual contact, sharing needles, syringes, or other drug injection equipment, or from mother to baby at birth. What are the signs and symptoms of HBV infection? Not all people with acute HBV infection have symptoms. The presence of signs and symptoms varies by age. Most children less than 5 years of age and newly infected immunosuppressed adults are generally asymptomatic, whereas 30% to 50% of people older than 5 years have signs and symptoms. When present, signs and symptoms of acute HBV infections can include: the symptoms include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored stool, joint pain, and jaundice. What is hepatitis C? Hepatitis C is a liver infection caused by the hepatitis C virus, HCV. Hepatitis C is spread through contact with blood from an infected person. Today, most people become infected with the hepatitis C virus by sharing needles or other equipment used to prepare and inject drugs. For some people, hepatitis C is a short-term illness, but for more than half of people who become infected with the hepatitis C virus, it becomes a long-term, chronic infection. Chronic hepatitis C can result in serious, even life-threatening health problems like cirrhosis and liver cancer. People with chronic hepatitis C can often have no symptoms and don't feel sick. When symptoms appear, they often are a sign of advanced liver disease. There is no vaccine for hepatitis C. The best way to prevent hepatitis C is by avoiding behaviors that can spread the disease, especially injecting drugs. Getting tested for hepatitis C is important, because treatments can cure most people with hepatitis C in 8 to 12 weeks. What are the signs and symptoms of HCV infection? People with newly acquired HCV infection usually are asymptomatic or have mild symptoms that are unlikely to prompt a visit to a healthcare professional. When symptoms do occur, they can include fever, fatigue, dark urine, clay-colored stool, abdominal pain, loss of appetite, nausea, vomiting, joint pain, jaundice. What is HIV? HIV, human immunodeficiency virus, is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS, acquired immunodeficiency syndrome. There is currently no effective cure. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment can live long, healthy lives and protect their partners. Are there symptoms? Some people have flu-like symptoms within 2 to 4 weeks after infection, called acute HIV infection. These symptoms may last for a few days or several weeks. But some people may not feel sick during acute HIV infection. These symptoms don't mean you have HIV. Other illnesses can cause these same symptoms. See a healthcare provider if you have these symptoms and think you may have been exposed to HIV. Getting tested for HIV is the only way to know for sure. Possible symptoms include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. Recognizing and eliminating bloodborne pathogen exposures. While dealing with blood in the school setting, you may be exposed to HIV, hepatitis B, and hepatitis C. Although your risk is low, you owe it to your students, coworkers, and yourself to know how to safely handle blood. Knowing these steps will help you eliminate exposures. Know the exposure control plan. This plan has been designed to protect employees who must deal with blood or body fluids. It is based on the guidelines for workplace safety according to OSHA standards. Follow universal precautions and always be prepared for an emergency. Always have personal protective equipment, PPE, with you. Although you may instinctively want to help a student or coworker, make sure that you first protect yourself properly. An approach to infection control used to protect employees from exposure to all human blood and other potentially infectious materials. Treat all human blood and body fluids as if they are infectious. Observe universal precautions in all situations when there is a potential for contact with blood or other potentially infectious materials. Know how to properly discard bloody materials and disinfect contaminated surfaces. The hepatitis B virus can survive at room temperature on a dry surface for at least a week. Vaccination. If you are not eligible for the hepatitis B vaccine through your employer, speak with your physician with regards to obtaining the vaccine. The hepatitis B vaccine does not protect against hepatitis A or C. Practice good hand-washing techniques. This is the most important defense against the spread of disease. Wet your hands with clean, running water, warm or cold, turn off the tap, and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Need a timer? Hum the "Happy Birthday" song from beginning to end twice. Rinse your hands well under clean, running water. Dry your hands using a clean towel or air dry them. How to use alcohol-based hand sanitizer. Apply to palm of one hand. Rub hands together. Rub the product over all surfaces of hands and fingers until hands are dry. Remember, if hands are visibly soiled, wash with soap and water. Wear during possible exposure with potentially infectious materials. Check gloves before use. Remove contaminated gloves before leaving work area. Wash hands after removing gloves. Never reuse disposable gloves. Types include vinyl, latex, neoprene, or utility gloves. Some commercial solutions will effectively disinfect surfaces and equipment. Look for a tuberculocidal agent that kills hepatitis B virus. Store cleaners according to label instructions. Household chlorine bleach. Solution must be made fresh every 24 hours. Use a 10% bleach solution.